And it goes a little something like
Physical development. During puberty, many people begins to explore their sexuality and start to figure out whether they are homosexual, bisexual, heterosexual, or another identity. This is totally normal, and each person's experience is different. Not everyone will have feelings of attractions for others, and this is nothing to worry about either. People who do not develop sexual attraction may choose to identify as asexual. During puberty, some people begin to notice that their gender identity, how much they feel like a girl, a boy, or neither, does not match their body. If this happens, the physical changes of puberty can cause emotional distress known as gender dysphoria. Physical development of females. One of the first signs of puberty in females tends to be a breast pad, a small amount of firm tissue under the nipple. Periods typically begins around 2 years after breast development at a stage of about 12.5 on average. Along with periods, people may experience symptoms of premenstrual syndrome, known as PMS. Emotions may fluctuate more around the time of a period due to natural variations in hormones level during the menstrual cycle. Other signs of puberty includes the start of vaginal discharge, body odor, and hair growing in pubic area, under the arms, and on the legs. Often, the hips widen, the waist becomes proportionally smaller, and extra fat develop around the stomach and buttocks. But all bodies develop differently during this time, and there is no normal. Each person develops their unique size and shape. Physical developments of males. In males, the earliest sign of puberty are growth of the testicles, then the penis. The skin that surrounds the testicles, called the scrotum, becomes thinner and redder. Body hair begins to grow, typically on the face, chest, armpits, back, and pubic area. Some people start shaving, and this can cause a rash, especially on sensitive skin. Using shaving foam or gel can help, and using electric razor can reduce the risk of cuts. Meanwhile, the voice starts to get louder and deeper as the voice box or larynx grows. A person's voice may crack sometimes. This is normal and goes away over time. The Adam's apple, which is the visible bump in the throat, may get bigger. Some males also experience swelling around their nipples during puberty. This usually goes away in around half of males. It can last a few months or a few years. The chest and shoulders tend to become broader, and most people have growth spurts. The total amount of the body fat typically starts to drop as muscle develops. A person may start having involuntary erections and wet dreams, or ejaculating while sleeping. They may wake up necessarily the results of sex dreams or touching the penis. These two are normal.
Intellectual development. Intellectual and behavioral development. In early adolescence, children begin to develop the capacity for abstract, logical thought. This increased sophistication leads to an enhanced awareness of self and the ability to reflect on one's own being. Because of many noticeable physical changes of adolescence, this self-awareness often turns into self-consciousness with an accompanying feeling of awkwardness. The adolescent has also a preoccupation with physical appearance and attractiveness and a heightened sensitivity to differences from peers. As adolescents encounter schoolwork that is more complex, they begin to identify areas of interest as well as relative strengths and weaknesses. Adolescence is a period during which young people begin to consider career options, although most do not have a clearly defined goal. Parents and clinicians must be aware of the adolescent capabilities, help the adolescents formulate realistic expectations, and be more prepared to identify impediments to learning that need remediation, such as learning disabilities, attention problems, behavior problems, or inappropriate learning environments. Parents and clinicians should facilitate apprenticeships and other experiences that expose older adolescents to potential career opportunities, either during school or during school vacations. These opportunities may help adolescents focus their career choices and future studies. Many adolescents begin to engage into risky behaviors, such as fast driving. Many adolescents begin to experiment sexually, and some may engage into risky sexual practices. Some adolescents may engage in illegal activities, such as theft and alcohol and drug use. Experts speculate that these behaviors occur in part because adolescents tend to overestimate their own abilities in preparation for leaving their home. Recent studies of the nervous system also have shown that the parts of the brain that suppress impulses are not fully matured until early adulthood.
Body image is a multidimensional, dynamic, unstoppable, and fundamental social construct formed from a complex combination of attitudes, feelings, and values rooted through the representation and stereotype that social groups value and convey throughout time. Body image in adolescents is a powerful construct affecting their behaviors. In current society, body beauty and importance of body are factors that lead adolescents to be dissatisfied with their own appearance, psychological maladjustment, and several disorders such as eating disorders. The physical charges of puberty, especially overweight, are mentioned risky factors of adolescents, body image, disturbance, and psychological adjustment. Body image is a phenomenon that is strongly connected to gender, and the nature of any developmental process is different for each sex. To be more accurate, girls concerned about overweight and boys are mostly concerned with low weight and lack of enough growth. The physiological process occurring during adolescence, often the abrupt, threaten the permanence of the previously constructed sense of identity, questioning the pattern and representation that had governed the relation of the teenager with his body and with his relation system. Although puberty is not only reduced to sexual transformations, definitions centered mainly on this aspect can be found in the literature. In fact, pubertal development is the acquisition disclosure index of adult reproductive capacity. Relationships between parents and children continue to play a significant role in children's development during early childhood. Parenting styles can also be affected by concerns the parent has in other areas of their life. For example, parenting styles tend to become more authoritarian when parents are tired and perhaps more authoritative when they are more energetic. Self-identity develops over time for all humans beginning at birth. It relates to understanding what is you versus all other things and people in the world. Having the sense of who you are is critical to children with significant special needs and ties into your ability to relate socially and emotionally to others. Emotional and behavioral problems in children are more common when their parents are fighting or separating. Children can become very insecure. Insecurity can cause children to behave like they are much younger, and therefore, bedwetting, clinginess, nightmares, worries, or disobedience can all occur. Families are the first and most important influence on a child's social emotional development. For the most part, families naturally fulfill this responsibility by simply being responsive to their child's needs and providing a safe environment to grow and learn.
Social development. Strong peer effect. Peer pressure or influence is when you do something because you want to feel accepted and valued by your friends. Peer influence can be positive or negative. Coping well with fear. Influence is about getting the right balance between being yourself and fitting in with your group. If you stay connected with the preteens and teenager and build their confidence, it can help them cope with the peer influence. Example of positive peer pressure. Your child might be influenced to become more assertive, try new activities, or get more involved with school. But it can be negative too. Some teenagers might choose to try things they normally wouldn't be interested in, like smoking or behaving in antisocial ways. Peer pressure and influence might result in teenagers choosing the same clothes, hairstyle, or jewelry as their friends, listening to the same music or watching the same TV shows as their friends, changing the way they talk or the words they use, doing risky things or breaking rules, working harder at school or not working as hard, dating or taking part in sexual activities, smoking or using alcohol or other drugs. Increased health risk behavior. Adolescence is a critical transitional period that includes the biological changes of puberty, the need to increase independence, preoccupation with the self, and normative experimentations during the transition from childhood to adulthood. Adolescence struggles to make lifestyle choices and establish patterns of behavior that affect both their current and future health. The number of health risk behaviors begin in adolescence that affect health both at the time and in later years. Some of these behaviors contribute to the leading causes of mortality and morbidity among adolescents, such as suicide attempts, injuries, and various risks associated with unprotected sexual behaviors. Conditions related to tobacco or alcohol use, and overweight or obesity. The majority of adolescents' death is illness are caused by risk behaviors that can be grouped into four categories: the tobacco, alcohol, and drug use, dietary behaviors, physical activity, and sexual behaviors. These key health risk behaviors are often the focus of prevention strategies for non-communicable disease and some sexual conditions. Behavior change is based on social cognitive theory and social ecological model of health, which emphasize a dynamic interaction among cognitive, behavioral, and environmental factors over the life. course of individuals, families, and communities contributing to the health of population. An understanding of risk and protective factors at multiple levels, including the adolescents, family, school, and community, has influenced intervention development. Sexual interest in peer. Well, like adolescents are more likely than their peers to engage in sexual behaviors, which may place them at higher risk of negative outcomes such as sexuality transmitted infections and unwanted pregnancy. Yet, little is known regarding whether peer acceptance in adolescents predicts sexual outcomes in young adulthood. Understanding developmental links between peer acceptance and sexual outcomes will inform theories of how peer affect health and can help identify targets for health promotion efforts. Early vocational plans. The purpose of vocational planning is to utilize the information obtained in the intake and assessment phases to assist the participant to select a realistic and achievable vocational goal and to identify the services and sequential actions necessary to achieve that goal. The vocational counselor is responsible for obtaining approval to coordinate the purchase of goods and services on behalf of the participants. For the portion of the vocational plan would require employability assistance for people with disability, individualized training funding. The goods and services to purchase on behalf of the participant will help to remove the barriers to employment and facilitate the participants' efforts to pursue, secure, and maintain employment. Increased impulse control. An impulse control disorder is a condition in which a person has trouble controlling emotions or behaviors. Often, the behaviors violate the rights of others, conflict with societal norms, and the law. Example of impulse control disorders include oppositional defiant disorder, conduct disorder, intermittent explosive disorders, kleptomania, and pyromania. Males may be slightly more prone to impulse control disorder than females, and these disorders may commonly co-occur with other mental health disorders or with substance abuse. Impulse control disorder may be overlooked or misdiagnosed, meaning that many individuals suffering from this disorder may not get the help they need. A better understanding of the disorder can help close the treatment gap and get individuals proper care to improve symptoms. Treatment for impulse control disorder often involves behavioral therapies, and medication may also be beneficial. Emerging social autonomy. What is social autonomy? A type of autonomy defined as the ability to function effectively when being a cooperative member of a given group. Why is autonomy so important? The sense that one is responsible for making decisions and the ability to stand behind those decisions when given a task drives involvement, often leads to innovations and definitely increased job satisfaction. Children express a desire for autonomy at two stages, toddler and adolescence. This sense of self-governance, feeling, behaving, and thinking independently becomes particularly profound in the latter set of years, as adolescents have more of an understanding of the world around them and confidence in their own abilities. While every parent wasn't their child to grow in this way, and doing so is important to living a happy and productive life as an adult. This transition often comes with some difficulties both for sons and daughters as well as mothers and fathers. Developing autonomy helps teens make emotional, behavioral, and values-based decisions in preparation for adulthood. but this can often cause tension between parents and adolescents. Instead of communication and closeness, which is what many parents want most and perhaps are even used to enjoying, quarrels and rebellious behavior can strain the parents and child relationship. Teens learn best through practice and they want and need to learn to manage their own lives. In doing that, however, they must also have guidance and support from their families, even if they don't think that they need it. You can help them in this stage in a number of ways. Set clear and consistent expectations with regards to curfew, dating, after-school employment, or volunteer work, driving privileges and safety. And when it comes to saving or spending money, it is also important to remember to adjust some rules to meet your teens' changing need as they grow. Bullying. Bullying is unwanted, aggressive behavior among school-aged children that involves a real or perceived power imbalance. The behavior is repeated or has the potential to be repeated over time. Both kids are bullied and who bully others may have serious, lasting problems. In order to be considered bullying, the behavior must be aggressive and include an imbalance of power. Kids who bully use their power, such as physical strength, access to embarrassing information, or popularity, to control or harm others. Power imbalance can change over time and in different situations, even if they involve the same people. The second one is repetition. Bullying behaviors happen more than once or have the potential to happen more than once. Bullying includes actions such as making threats, spreading rumors, attacking someone physically or verbally, and excluding someone from a group on purpose. Types of bullying. Verbal bullying is saying or writing mean things. Verbal bullying includes teasing, name-calling, inappropriate sexual comments, taunting, threatening to cause harm. The second one is social bullying, sometimes referred to as relational bullying, involves hurting someone's reputation or relationships. Social bullying includes leaving someone out on purpose, telling other children not to be friends with someone, spreading rumors about someone, embarrassing someone in public. The third one is physical bullying, involves hurting a person, body, or possessions. Physical bullying includes hitting, kicking, pinching, spitting, tripping, pushing, taking or breaking someone's things, making mean or rude hand gesture. Where and when bullying happens. Bullying can occur during or after school hours. While most reported bullying happens in the school buildings, a significant percentage also happens in places like on the playground or the bus. It can also happen traveling to or from school, in the youth's neighborhood, or on the internet.
Moral development focuses on the emerged changes and understanding of morality from infancy through adulthood. Moral development has 0 to 5 stages. The first stage is a concentric reasoning. This stage starts around preschool age and ends around the age of 4 years. First stage, unquestioned obedience. This stage usually takes place around kindergarten age 5 years. Second stage, what's in it for or me fairness. These stages usually begins around the age of 5.5 to 7 years of age. Third stage, interpersonal conformity. This stage usually takes place during the middle to upper elementary grades and early to mid-teens. 4 stages, responsibility to the system. These stages typically emerge during the high school years or late teenagers years. 5 stages principled conscience. These stages is the last stage and emerges in young adulthood. Language development and use in adults. We often think of language development as ending in adulthood, but actually language continue to grow in different way. This lesson discusses language development and use in adulthood. Thinking about language in adulthood. Language development. This is the SOPHY focuses on overall developmental trajectory of language in adulthood. Speaking and listening. Reading and writing. Language use. Aging and language development.